whenever you're ready.
Today we're here to talk to you about our initiative, Heads Together, a nonprofit organization that will aims to end the stigma around mental health as well as provide options for those struggling with mental health to get help. In 1988, Elizabeth Manley competed in the Winter Olympics as a figure skater. She went on to win the silver medal in freestyle. However, 4 months later, she lost all of her hair, gained 40 pounds, and most importantly, quit skating. After months and months of wondering what was wrong with her and seeing many doctors, she was finally diagnosed with severe depression and was told that at the young age of 17, she was undergoing panic attacks. She felt very insecure and didn't know who to go to. She didn't tell her family because she felt the stigma around having a mental issue. So she tried different antidepressants, which didn't work, and then after about a year and a half of being on different medications, tried talk therapy. 4 years after trying talk therapy, she started to gain or lose her weight back and started figure skating. Now, we would like to think this is a 1 in a million thing, that this doesn't happen to everybody, that she was under a lot of stress, but this is an issue we're seeing in young adults and adults throughout the nation. People don't know where to go when they have mental health issues, and they feel very ashamed that they're having these issues, whether it be depression or anxiety or bipolar disorder. There are so many different mental health issues, and we see this, that they're growing, that there's a number of people with mental health issues is growing, and that there's a lack of education. People aren't being taught what to look for, how to combat these issues, as well as there's a lack of resources or a lack of knowledge about the resources available. So that's what we hope to address with our nonprofit. I'm going to be discussing our growing mental health issues first off. So in the last decade, there is increasingly high amounts of medical substantiation for different disorders that are being real, such as multiple personality disorder, which up until a few years ago was believed to be completely non-existent. But here I have a quote saying, "Diagnostic categories based on clinical consensus fail to align with findings emerging from clinical neuroscience and genetics." This is from the Research Domain Criteria toward a New Classification Framework for Research on Mental Disorders by Thomas Insel, a neurologist and psychiatrist who ran the National Institute of Mental Health for 13 years. New research is emerging everywhere that's proving and disproving other disorders. For instance, people would diagnose with schizophrenia that might have bipolar disorder, or diagnosed with schizophrenia that might have multiple personality disorder. People are getting misdiagnosed all the time, put on bad medications, getting the wrong help at therapy, and they don't know what they're doing. Next, there was a study on 146 bipolar patients from 1978 to 1981 that focused on bipolar depression. They recorded weekly affective symptom status, bipolarity, and severity of each patient. They've concluded that bipolar disorder is more depressive than manic, which is the social stigma and stereotype for bipolar disorder. The long-term natural history of the weekly, this is from the long-term natural history of weekly symptomatic status of bipolar disorder by Louis L. Judd, chairman of UC San Diego, and runs a broad program on clinical research for new disorders. Why is mental illness growing? In the article challenging the claims that mental illness has been increasing and mental well-being declining, Joan Busfield, Director of Education at University of Essex in the Department of Sociology, she claims that mental illness has been growing since the Second World War. The problem that they've been having is that a lot of studies on mental illness are based on a set of questions, a very broad set of questions that can't necessarily boil it down to one disorder that could be affecting this person, and at the time they didn't have as much medical proof on different disorders as well. The inadequacy of such studies that are too broad, and so they aren't significant. Also, in mental illness growing, it's a lot in schools.
First, schools must recognize that it is not competition and hard work that causes stress and mental health issues among their students rather than fear and anxiety. This is from The Causes of Growing Mental Health Problems. It sits largely within schools by Peter Tate, a psychologist and hypnotherapist with 35 years of experience in learning and cognitive education. This shows a lot of students have an issue with not feeling part of the loop because they have a mental disorder that they haven't been diagnosed with yet. When you have a mental disorder, sometimes you feel like an outsider because you're having a lot harder of a time dealing with all of the assignments piled on top of you or the social stress that happens with social groups in high schools. And you think, what's wrong with me? What am I doing wrong? Because you don't know that you have a mental health issue. You might have anxiety or depression. And that does cause a lot of issues with getting the work done. They struggle with feeling alone. They ask themselves why they're not normal, and they don't know. They can't get help. They feel afraid to tell their parents because they're afraid to be judged. Why people are not getting help. The study Stigma, the Feelings explained of 46 people with mental health illness. 46 people were asked to explain about mental health illness with the goal of researching whether stigmas affect it. The result, there are two categories of stigmas that affect mental illness. There is subjective stigma and stigma with overt discrimination. Still, there are lots of negative views about mental health illness and judgment on people with mental health issues. People are considered lazy rather than having an issue in their mind that they can't help. People don't want to admit that they might need help because they're ashamed of it, and people don't want to be different. They have a lack of education as well in society that doesn't teach us in our public schools about different mental health disorders and doesn't teach us where we can get help. So I'm going to pass it to Felipe, who's going to talk about our next issue.
Our next issue is the general lack of education in the public and in the community. One reason for this is because of social stigmas, like we've been saying. Gender influence is one of the bigger ones. So basically it is an image of a violent medical illness like alcoholism is more associated to males, and then when like depression is more associated to women. A national study done by psychologist James Worth from Purdue and Galen Bodenhausen from Northwestern got a group of volunteers varying from age, education, and class, and they read about two people who had different social illnesses. Some read about Brian, who was an alcoholic, and some read about Karen, who had major depression. And then vice versa, some read about Karen, who had alcoholism, and Brian, who had major depression. The volunteers expressed anger and disgust and less sympathy for Brian, the alcoholic, rather than Karen, the alcoholic, and vice versa with the depression. More striking, though, from this is that volunteers said that Brian with the depression, as well as Karen with the alcoholism, it was a genuine biological disorder rather than character defects or matters of personal responsibility. Another stigma would be behavioral ones. So inner city health associates said that people with mental illnesses need to be feared. Most people think that they need to be kept out of the community because they have short fuse and they're very dangerous, and that fuse could go off at any time. They also said that the majority of people are scared to help them on the streets just in case of an emergency. This is because they would either be very uncomfortable and they wouldn't know what to do. Unlike when you see someone falling on the street or getting hit by something or having a heart attack, most extreme case, people would see that they have a visible medical issue, so they would come and help them more likely than if they had a mental issue. They also said that many mental illnesses are related to criminal activity as well as drugs, which is a very big stigma as well. Amy Watson, a psychiatrist from the University of Chicago, said that childhood attributes are a big stigma within the community. So they are people with mental illnesses are seen as irresponsible, and they need direction and need to have people make big decisions in their life rather than them making a decision. They need to be looked at closely. They also say that they have a weak character, and their illness is generally looked at as their own fault, and that they can get over it rather than something that's biological or genetics or with life experiences. Also, something that is not looked at much as a self-stigma. I use the analogy of having a broken arm. if you have a broken arm, you get a cast, and you let people sign it. It's whatever. It's kind of like a pride thing. But if you have depression or something, you don't tell anybody about it. You don't express yourself because you feel out of place and whatnot. The other thing that we can talk about is educating students at schools. That doesn't happen very often, mostly because that there is a lot of different disease or mental illnesses coming into play all the time, and people need to do research on them before we teach them to students, as well as the stigmas I stated earlier. Why it should be taught in schools is it robs the youth of the ability to make certain decisions about their own health. Also, it encourages people to get help if they need it. Also, they can look at their signs and they can find signs early just in case they need help. So now I will be giving it over to Gabby.
Okay, in this phase I'm going to talk about the lack of resources. So we all know about Planned Parenthood and Centers for Battered Women, and those are nonprofit organizations that cater to a very specific area. There is yet to be anything in the Lawrence community that is specifically implemented for mental health issues. That's why we're here. Our organization, Hands Together, will be a central location where people can go and receive information and help in all regards to mental health. In the Journal of Counseling and Development, written by Dr. David Vogel, Dr. Stephen Wester, and Dr. Lisa Larson, who have all earned their doctorates at the University of Indiana in psychology, stated that one of the top reasons, there's many, but one of the top is that people simply just do not know where to go. They are lost, they're confused, and they have no place to turn to because there's simply a lack of resources in this area. So many do not want to start off by seeing a therapist or a psychiatrist because they're okay, something's wrong with me, what do I do? I don't want the stigma of seeing a psychiatrist or a therapist because they don't want that put on them. So Heads Together would provide the assistance and resources, numerous resources of different places that you could go, not just necessarily therapy or anything like that. We would just can't give these resources to anyone that was looking for them because people are so greatly unaware of what is available to them and they just think of the bare minimum, which is a huge issue. There needs to be a central hub located here in Lawrence that will cater to this issue. The National Institution of Mental Health reported that the age group most affected by mental illness is ages 18 to 29. That being said, that's a huge chunk of that age group is in college. And here in Lawrence, we do have Watkins Health Center, but something about Watkins is that if you walk in there and if you've had any previous record of suicidal thoughts, you are going to be instantly turned away. They do not have the resources at Watkins to cater to all spectrums of mental health. And that is a huge issue that we're facing here in Lawrence that affects anyone that may be having some sort of mental health issue. So that's another huge reason why this needs to be implemented because it provides another source of help. Next, we're gonna talk about our solution now. So I want you guys to all keep in mind our 3 problems, and I'm gonna introduce our solution. So I'm gonna start off by addressing the pro bono and solution to a stigma. So pro bono is something that we believe is very necessary in an organization like this because times can be really rough financially for a lot of people, and we don't want that to be a factor in why they don't seek help. People will not go out and they will not seek help because they are not financially capable, and that's why we want to offer pro bono work in our nonprofit to be able to offer that to anyone who wants to receive help can receive it. We also want to end the stigma in this by doing community outreach. We want people to realize that there should be no fear of going somewhere because they need help. Whether it be anxiety, anything that they're facing, they need to not be afraid. And we want our center to be kind of almost like a safe haven place where people can go and receive help, and they are not going to feel ashamed of themselves. They're not going to feel like they did something wrong, and we're going to provide them with the best help that we possibly can. And hopefully with this, we can end the stigma and we can help reduce that because people will be like, oh, this is a place I can go to receive help that will not have any judgment, that will not make me feel like I am not a right person. And so I think that's a huge goal that we want to obtain within this, is to make sure that people, just any walk of life, can come in, and no matter their financial status, no matter like where they came from, anything like that, it doesn't matter. And we want to end the stigma and make sure that anyone will come in and can receive help if they want to.
Alright, so I'll be talking the community outreach solution part. One thing we thought about was campaigning. Although we were doing a different kind of campaign, all campaign want to appeal to the target audience, present the idea in a real life situation so then the audience can get engaged a little more, have it easy to follow, and have people leaving the campaign talking about it. We wanted to talk about having motivation, not necessarily education, so people can go out and do stuff for it. There's an online campaign, the March of Dimes, which is aimed for babies, aimed to save babies from getting any type of paralysis from birth. This started because of FDR having polio, and this organization helps fund research and vaccines for babies. But one thing they did recently was they started using Facebook and Twitter to have public videos and video stories of people that are directly affected by this. By allowing people to do this, they have created a very consistent strategy, and that aligns with their mission, and it also creates an emotional appeal, so it gets people more involved. You see those puppy commercials about getting adoption and all that stuff, and technically it works very well. Another thing we thought about doing was seminars. So we thought about 3 main steps of creating a seminar and presenting the seminar. Our first one is to set a clear objective and present a specific purpose for it. If the people coming in and watching your seminars don't necessarily know what we're talking about, you have already lost them before you started presenting. So we want to create a clear message right from the get-go. The second one is strategically develop the content that makes the audience needs feel met and have a clear key message. So during this, we want to have not so many ideas, but focus on one key main point and key main idea. And we need to talk about what the audience needs to know, not what we want to tell them. The third one is we need to engage the audience with interactive communication. We got to keep it simple because they do need to grasp the info and contain it all. But if we engage the audience, they'll be more likely able to go out for help, go out for research and whatnot. So lastly, for our last solution.
So I'm going to talk about the need for a database. Currently, there is no all-inclusive database for mental health. There's nothing that has all doctors, disorder information, insurance information all in one place. Electronic medical records have become really popular since the rise of the internet, and that's where they keep all of your medical records on a website, on the internet, so that other doctors can access them later and know your background without having to ask you questions over and over. Insurance companies do have lists on their websites of doctors that they cover and different places that they cover, but they don't provide all the info we need. For instance, the United Healthcare website has a Find Care Providers area, and if you go in that, you can see a list of care providers, but it's just the name and they give you the number. You can click on them and find what they cover for disorders, but that's not an effective way to organize a database because you're just looking at names that mean nothing to you rather than what disorder you think you might have or think you already do have. They don't tell you copay prices either, so you don't know exactly how much you're going to be paying or if you can afford it. And also you have to call the doctor. People with mental illness sometimes have social anxiety or an issue with talking about it, and so if we provided a database that they could just make an appointment online like we do with Watkins here, they would feel a lot more comfortable doing it rather than explaining to a doctor on the phone that they're suicidal and they need an appointment, or they have anxiety and they need an appointment. The purpose of the database is just to have a place that people can go at our center where they can find care providers or find care providers from their own home, contact them, get help, and make sure that they're educated about their disorders. It also tells them if they qualify for care and copay prices. So in 2008, a mental parity law was passed. This requires insurance companies to treat mental health and substance use disorder coverage equal to or better than medical insurance or surgical expenses. This is from Does Our Insurance Cover Mental Health Services by American Psychological Association Help Center. This means that they can't charge a higher copay than they would at the doctor, for a physical illness. And they've eliminated the annual visits cap for mental health, because there used to be a certain amount of money that insurance would cover in a year before they said you can't have therapy anymore, you can't have help anymore. And we also want to educate people about their rights for insurance and their rights for mental health, and their ability to get help in this community. And then we'll be concluding it with Alyssa.
I'm gonna go over the
sorry.
finances really quick, just so you guys know where your money is going to, because I think that's a very important thing. So this is just kind of a small window of where we would like to start with our resources. So what basically the cost, and it's like the seminars, the database construction cost would be $2,000 to $4,000 to make sure that we have adequate information and everything is up to date, and that works out. So we calculated that out. And then campaign seminars, roughly seminars would be about $6,000, because if we did one every other month, it's roughly like $500, I think. So it would total out to around there. And so then $1,000 for advertisement. Our main mode and medium would be using Twitter, Facebook, social media outlets. That way it doesn't cost us that much, but we would like to invest in some sort of advertisement other than that. Rental for our facility would start at about $650 per month, but we'd probably see that grow within the years, because we would like to expand our facility into something bigger. So that's where it would most likely start at. And then labor, we kind of did a very rough estimate of about $5,000 just in total to start, like we said, and this would all come out to a little less than $25,000. And so those are the financial options.
So as we conclude, we want to remember that we started with Elizabeth, who from the outside in was a 17-year-old silver medalist in the Winter Olympics. People would think that she had a great life, but for her, she quoted, "My life could not get any lower. I was paralyzed by my disease." So we see this, and that is exactly what we want to stop. We want to stop this paralyzation. We want to stop this lack of education of where to go. Today we look at her 4 years later after receiving help. She went back and won the gold medal in the Freestyle Winter Olympics figure skating. And she spends her time now promoting or being a spokesperson for mental health and telling people where they can get their help and to not be afraid, to end the stigma. So what we want to do is we offer our pro bono options, which will be a list for people of where to get help, of local providers who are going to give of their time back to the community to help issues battling mental health issues, as well as end the stigma with seminars and outreach programs such as advertisements on social media outlets and flyers around town, on TV, whatever we can get to help our organization grow. As well as another big part would be the database, where people could go if they don't want to contact us, find out what their health insurance will cover, how much it'll cost, where to go. So I want to thank you for your time as you consider Heads Together.
Any questions for this group? All right,